parents, Susan Bolig and Mary Bachman, talk about their struggles in the healthcare system getting access for their autistic children.
So my son is 18, so I've gone through behavioral health, I've gone through therapies, I've gone through the school, I've gone through IEPs.
Right.
Now we're looking at Social Security disability, also looking at with insurances, waiver funding when he turns 21.
Right.
It's exhausting. My husband always had good health insurance and vision and dental. He works at Wood and Metal, so his insurance, he still has a job. Right? So he's a separate plant from Wood and Metal.
Okay.
So he still has a job.
My heart just dropped for you.
But it's been kind of a weird nightmare. So,
Yeah.
but all the insurance dropped across the board.
Yeah.
So my husband did lose insurance.
Yeah.
Now, Ryan was able to keep medical assistance, but in the meantime, where we were going for therapies, we then, I'm like, I'll pay privately, don't, because they were going to switch him to a different location, and I don't want to do that. We've been going for therapy since he was 3 years old, and so that was kind of, so now we do have medical insurance, but we don't have vision and dental.
Yeah.
So my son has vision and dental through his access card, but there's nobody that will take it.
I had a very hard time getting my son diagnosed. Brought my son to the pediatrician for his normal appointments. He was always behind in speech. And I just kept bringing up to the pediatricians, his speech. It's okay. And I would say, other little things that were concerning me. It's okay, he's a boy, he'll grow out of it. It's okay, he'll grow out of it. And so then we got put on a wait list for ADMI here in Lewisburg. And it was 9 to 12 month wait list to get called for an appointment.
Here.
When I started with the early intervention services, we started with a teacher, the added a speech therapist and OT, and then they were the ones that said, I think he needs to be evaluated.
Yes.
And so we went to the ADMI clinic, but I only waited 6 weeks.
Wow.
So, so we got in right away, got the diagnosis.
That was back, how many years ago?
He was diagnosed at 2.5 at the PDD, and then at 3 with the autism.
Maybe 15, 16 years ago.
Yeah.
And at that point I was getting really frustrated because his signs of autism were becoming more and more prevalent and more frequent. Yeah, we were waiting so long that we went to Cleveland Clinic in Ohio, which has an attached learner school for autism. So I knew that it would be a reputable place to get an official evaluation, a thorough and complete evaluation. So we took him there. They were wonderful. Got the eval. 2 weeks prior to the eval, he was told by his PCP's office that, well, he's making eye contact with me now.
Oh.
I don't think he has autism. Literally 2 weeks later, he had the full eval, moderate autism. Right there, Cleveland Clinic, moderate autism. So I faxed it over to them.